Good afternoon, everyone. We have updated you for many weeks at these briefings on the latest developments in our response to COVID-19. Today marks a minor milestone as we start to talk about starting the journey towards normality for our health and care services. Teams in the department have been working hard on plans to reintroduce those services which were suspended or reduced as part of our immediate response to the crisis. We are keen to share these plans with the public, and I will shortly be launching a new roadmap document setting out the journey ahead. Also today, we welcome back from the COVID 111 call centre Dr. Gregor Peden for an update on his team's work. But first of all, today's coronavirus statistics. The total number of tests undertaken stands at 4,393. The total number of tests returned stands at 4,381. That leaves the number of test results outstanding at 12. The total number of cases testing positive remains at 336. That means there have been no new cases identified since yesterday's update. And I would now like to hand over to Dr. Gregor Peden for an update on the COVID 111 operation. Over to you, Gregor.
Thank you, Minister. Good afternoon, everyone. I'm pleased to be able to give you a brief update on the COVID 111 service and what plans we have in place going forward. The service launched 9 weeks ago on March 20th, and with a team of 140 individuals, we've now handled over 11,500 calls. Our peak call volume, averaging 600 calls a day, was a very big crisis. And my thanks again to the Max public for their patience. We dealt with the high numbers of tests and results. But as expected, as hoped, and as a result of everyone playing their part, the number of calls has gradually reduced, and we now process around 100 calls per day. We've tested over 3,600 individuals. The absolute test count is higher than this due to some of our retesting protocols, particularly around essential workers. And we've sent over 2,500 text message results and made about 1,500 callbacks from the service, either again to advise of results or to provide clarity around some of the advice. The service has had to constantly adapt to changes in both clinical guidance and local legislation, and we're currently operating from version 28 of our internal process flows. Of note here is the recent change in testing criteria in line with the UK, and as already announced this week, we now test cases of loss of taste or smell, or as before, cases of new cough or high temperature. If you do develop any of these symptoms, please call 111. Also, a reminder that all of our current advice is available online at covid19.gov.im, where you will also find the online assessment tool that will direct you to call 111 if required. This assessment tool has been used by over 20,000 individuals. As of next week, and in order to further improve the service, we are merging the 111 team, the community testing team, and our contact tracing team into a single structure to improve the speed and efficiency with which we share information and strategies. This will allow us to strengthen our test and trace service so it's robust enough to give us the confidence we need for when the time is right to open our borders, that we will be able to track, trace and isolate any potential outbreaks before they become an issue. And we as a team are confident that this refreshed service will allow us to keep the public as safe as we can for as long as is necessary, whilst supporting the economy to continue to open as the island moves forward together. Thank you.
And thank you, Gregor. Apologies, we had a few technical difficulties just there at the start of your talk, but thank you very much for sharing that. And thanks to your team for all of the hard work you and they have put in to make the service such a success. The COVID 111 service was set up within a week as part of our immediate response to the pandemic. It now seems a long time ago. The project brought together clinicians, project managers, web designers, IT experts, data analysts, team managers, and many more. By pulling together under pressure, we set up an entirely new service, which from day one adapted to suit needs. I very much hope we can retain this service in the future so that when the pandemic is behind us, we gain an effective, professionally designed new resource of real value to the people of this island. That is currently being looked at as a possibility. The service has certainly undergone some serious road testing in the most demanding of circumstances. Having achieved a significant reduction in the spread of COVID-19, we are keen to see health and care services that have had to be suspended resume in the near future. We are aware of the potentially negative impact of further delaying many usual healthcare services. It is a balancing act. On the one hand, we want to offer a comprehensive health and care system to the public, but on the other, we must consider the threat of the virus that is still circulating in the community. So it is important we plan the process of restoring services carefully. We need to keep resources available for dealing with COVID-19 and to be able to increase or decrease the number of beds available as required. It's a hard truth, but the potential to have large numbers of acutely unwell COVID-19 patients remains and is not behind us. So we need to ensure our staff and patients are safe and we do not contribute to a rise in cases. It's a simple equation. The lower the number of beds needed for COVID-19, the greater is our ability to deliver services for other conditions and to meet other wider social care needs. Tomorrow we are publishing Return to Health, the department's broad approach to restoring services. It shows how we will do this in 3 stages, which are closely aligned to the 3 levels in our island-wide response to the pandemic set out by the government in Stay Safe almost a month ago. So it is a health and social care companion to the Stay Safe document. It is important to stress that this document does not cover every service area operated by the Department of Health and Social Care. Plans to resume our adult social care and learning disability services, for instance, are still being finalised. These will be the focus of a further companion document entitled Back to Care, which will be published shortly. Back to Health will be published online, and we hope that you find it informative. Just as all policies and regulations around the current situation are reviewed on a 2-weekly cycle, in health and social care we will be reviewing services in 2-weekly blocks, seeing what else we can bring back online. So the restoration of services will be done in a carefully managed way, and we will be communicating a fortnightly programme of changes. Turning to the first block over the next 2 weeks. In terms of hospital services, the next stage is to resume some time-sensitive, urgent and elective procedures and activity. We will also look at restoring screening programmes, although this can only happen when the services we rely on in the UK are also up and running. Among the services we will be looking to bring back on stream in this first phase are endoscopy, general surgery, urology and certain cancer care and delivery services. In mental health, we will increase the number of in-person appointments and therapies for those who will benefit most from face-to-face contact. While some day services have had to close, our mental health teams have discovered new ways of connecting with service users, which have worked really well and which we hope to continue. The service has been aware throughout the crisis that demand is likely to increase during the changing social circumstances that we have all been experiencing. It has not been easy for many people to nurture their own well-being in challenging circumstances and times, and this is being taken into account as we plan the future. It means making the best use of resources will be paramount, and we will continue to innovate, as we have been doing, where we can, as well as work with third sector partners. The document also covers primary care. In primary care, we will continue for the time being with the use of telephone triage for GP services and be maintaining non-face-to-face services where this is appropriate. We will be looking to work towards the reintroduction of cervical screening and diabetic foot checks. The rest of the document also includes other services around GPs and opticians. Turning to dentistry. In terms of dentistry, we are not yet ready to allow dentistry services to resume as normal. Aerosol generating procedures, which form a large part of dentistry, are still a major risk. We will, however, in this first block of changes, be building on the emergency care available. By our NHS dentists partnering with the community dental service, we will be working to provide an expansion of services, including placing of temporary fillings and re-cementing of crowns. Within women and children's services, we will be looking to reintroduce admissions for specific groups to the children's ward, reintroduction of paediatric outpatient clinics, and expand on the community paediatric offering. Behind the headlines is a vast amount of detailed analysis, risk assessment and planning, all of which has to be considered by our leadership and clinical teams before it can be agreed as our firm plan. I would like to thank colleagues across the department who have worked so hard on these plans, as they are truly in the vanguard of shaping our health and social care services for the future. It is pleasing to see that some services are being transformed as they are being turned back on. So the service which comes back on stream is not exactly like the previous one. The difference is it will be better, as well as being more efficient and ultimately sustainable. I should also mention several areas which are crucial for any of the above to take place. These are areas we sometimes take for granted. The cleaning, housekeeping, catering and portering teams at the hospital and elsewhere. They have worked extremely hard, showed huge commitment and flexibility as they adapted and extended their operations during the emergency. These will change again as we return to normal, as social distancing, infection prevention practices and the use of PPE add a new dimension to previous routines. I hope this has given a flavour of the journey ahead. It is a challenging one, no doubt about that. We embark on it with some anticipation, as we understand people are anxious to have their appointments, therapies, visits, treatments and facilities back as they were. The road ahead offers many opportunities to rethink how we do what we do. It is an unfolding story which I provide updates on in the days and weeks to come. But the document will be published tomorrow, and I hope that people will take a look and engage with what services we are able to renew. I will now turn to questions from the media, and first up I've got Leanne from 3FM. Good afternoon, Leanne.
Good afternoon, Minister. I hope you're well. I hope my internet connection holds out this time. So my first question, I know you've just touched upon dentistry, but just looking for a little more clarification, because this morning we received a press release from the government to say the service has been expanded to offer emergency dental treatments, including fillings, with the department's dental service. But we've had reports that when members of the public have tried to call the number provided, they've been told this isn't possible. So just looking for a bit of clarification on that, please.
So my understanding is the services are coming online, I think, on Monday. So today is the announcement for the services, and I believe the services will be available from Monday, is my understanding in relation to that. Dentistry is one of those where we can't just do a big bang and back to normal. As I've stated before, the aerosol generating procedures is a great risk within the dentistry setting, so it needs to be done in a very carefully managed way. So I would like to thank all the dentists that have engaged exceptionally well with the department in helping to try and move the service forward, and that we are now able to expand using the emergency service with NHS dentists supporting that to be able to deliver this wider treatment such as fillings, crowns, because we do appreciate there's been people left in a situation that we wouldn't want them left in for a period of time now.
And so just to clarify, if people can phone up from Monday for that number, they should be able to talk to someone in regards to the likes of fillings?
Yeah, that's my understanding, Leanne.
Okay, perfect. And my second question, police have reported instances of social distancing being ignored, but in particular with young people, they've described their behaviour as unacceptable, but they state, as they always have, that it's their parents' responsibility to know where their children are. I'm just wondering, could a direct punishment be introduced to discourage other young people from doing the same?
Well, when you're dealing with minors, it is generally obviously you've got the age of legal responsibility that feeds into law as well. So it is the parents that do need to take responsibility there. I was very disappointed to read about the reports from the police. As we move out of the situation we're in now, more and more we are going to be relying on people doing the right thing. And I think the one message I've got to re-emphasise again is that this virus, it doesn't care about people's ages. It doesn't care who you are, what you are. It strikes people in exactly the same way. And young people are not invincible. No matter how much they may think they are not. There have been horrendous cases around the world, even in the UK, of where young people have tragically died from this virus at a very, very, very young age. And I really would urge young people to consider that. I know it's frustrating and it's hard. When you're young, you want to be around your friends, you want to be out, you want to be enjoying life. But for a short period of time, and it is only a short period of time in their lifespan, we are asking them to do the right thing for themselves, their friends, their families. Because if they catch it as well, let's not forget, after that, they're going home. And they may well pass it on to a loved one and infect their family as well. So I really would urge them to think before they act. And like I say, as we start unwinding things, we are more and more going to have to rely on people doing the right thing. We can't police every single action that people take. So I really would urge people to think before they act.
Thank you.
Next up, I've got Amanda from Jeff the Mongoose.
Good afternoon, Minister. There will presumably be a large patient backlog on the island due to the halt in a lot of the healthcare sector. Do you anticipate very long waiting lists for those services you've discussed today, and how do you plan to reduce that?
The simple answer and the honest answer is yes. Waiting lists will have expanded while this has been going on, because the people who are on the list, they're not magically going to get better. They're still going to be ill and still waiting for their treatment. In the short term, being blunt, the waiting lists will be longer than normal, because we have still got to keep that capacity for COVID-19. And then what we will have to do is then look to see what we can do once we come out the other end of this, to try and manage waiting lists with various waiting lists initiatives. But I've got to be honest with the general public that in the short term, while we deal with this, most definitely waiting lists are going to be longer.
Thank you. And secondly, the UK government has now ordered 10 million antibody tests, and there are plans to begin rollout next week. What is your current stance on immunity to the virus? Will those who have the antibody be free to stop social distancing, and how will this be monitored?
No, there are no plans for us to go down the route of saying you've got the antibodies, so you don't need to social distance, or the thing that has also been in the media recently about immunity certificates. We have no intentions around that. The reason being, we still do not know, and I'm sorry to labour the point because I've done it several times now, but we still do not know that having antibodies infers immunity. There just isn't the level of scientific detail at the moment, because this is a new virus, to say how long those antibodies stay around and if indeed they do actually confer immunity to stop someone from getting it again. So we are going to be taking a very sensible approach, although people will be able to see when we roll out our antibody testing whether they've had the virus or not. That will not mean they have a licence to go back to normal.
Can I just ask then what the specific point of the antibody test on the island is then, if we don't know if immunity is necessarily coming from the virus?
So the purpose is to see just how widespread the virus has been. We know that a lot of people, for instance, don't show any symptoms whatsoever with COVID-19. We know particularly the symptoms are mild in children. So children may just feel like they've got a cold or something like that, but it's the same in cases with adults as well. So what antibody testing does as a test is it allows you to see how widespread the virus has been around the community. It most certainly, and I have to emphasise this again, most certainly should not be used at this current time for someone to say, I've had it, I'm absolutely fine, I'm not going to get it again. The scientific evidence just is not there for that.
Thank you very much.
Next up, I've got Paul at MTV. Or
Hello,
MTTV. I nearly moved you onto a music channel there, Paul.
Before I start, I need more information, or if you can, clarify this new case the other day. I mean, the Chief Minister gave out all sorts of things, which was setting bells in my head ringing. It was a teenager, not in healthcare, not in obviously a care home, hadn't been travelling. I mean, all these things, we're now getting a glimpse of something quite different there, aren't we? Are you worried? I mean, you're trying to find that person, no doubt, that connects the dots now.
Yeah, I mean, obviously contact tracing takes place. Again, I'm sorry to labour the point again, Paul, because we are limited in individual cases about what we can share. All I can confirm is to emphasise what the Chief Minister said, that it was what I would term a young adult. So it was a young adult who basically hasn't been in any sort of other setting. It is a pure community case amongst a young adult.
I think he said teenagers. So in that case, that much data is out. How many other teenagers have you got? Right.
Well, in terms of the way we record amongst age ranges, Paul, we record age ranges by 0 to 19. So we don't separate out. And I can actually give you that if you bear with me one moment.
Yeah.
By age range, out of the 336 confirmed cases so far, the 0 to 19 bracket is 18.
Do you want to go through the rest while we're at it?
If you want, yeah, I'll happily go through it. So 0 to 19 currently makes up 18 cases. 20 to 34 is 67 cases. 35 to 49 is 83 cases. 50 to 64 is 87 cases. 65 to 79 is 37 cases. And 80 plus is 44 cases.
Which is where you'd expect it to be?
It is. Obviously, it affects the older age groups more. But again, I need to emphasise that doesn't necessarily mean there hasn't been cases in the younger age groups, because a lot of young people don't show symptoms or show low-level symptoms. So that is, again, tying in with Amanda's question. That's where antibody testing will actually be quite effective to see.
That was my aside. Now to the question. Dentistry. We have these two sets of dentistry set up already. I believe one will be doing the fillings. You mentioned that's back on, but we've talked about in the past that the amount of deep cleaning, the amount of precautions in there, you'll never catch up on that if it's only I think you said last time, maybe 4 cases a day potentially could be having a filling. And that's before any other dentists obviously come back online. That's not going to help, is it, really? I mean, obviously, it helps 4 people a day, but it's a massive backlog building.
Well, first thing I need to say is we're operating out of 2 premises in order to deliver this service. But the way we gear up the premises and the way you divide it off, because bear in mind, you're talking clinical rooms. So if you've got more than one clinical room, you can use more than one clinical room at the same time. But it's about ensuring that the patient is safe and the dentists and their staff are safe. So it is still limited treatment. I'm not trying to say everything's going to return back to normal instantly. We are now able to expand that treatment base, and obviously the priority will go to those that are in greater need in relation to access to those services. But it has to be done in a clinically safe way. And aerosol generation with COVID-19 is one of the most dangerous. There's certain scientific studies out there that show when it's aerosol generated, it can actually even survive in air particles for a period of time, let alone on surfaces. So there has to be that rigidity around cleaning before other patients come back in.
I take that, but you accept that there's been HIV, there's been all sorts of the flu, whatever. I mean, with our numbers so low, you might be more chance of winning the lottery than actually catching anything by the sheer sort of percentages we're dealing with now.
Well, firstly, let's remember HIV is transmitted in a different way to COVID-19. Let's also remember when you mention flu, COVID-19 in terms of its contagion is actually higher in terms of your being able to pass it on. So although worldwide you haven't seen as many cases as you would see in a general flu, it is actually more contagious, and also the impact that it has potentially on vulnerable people in society is actually higher. So, that's not a reason to mitigate risk factors at all.
No, I'm simply saying there's a risk in everything, just walking down the street, that we all take our gambles in everyday life anyway.
Yeah, I mean, I could walk out of a door and get hit by a bus, but what we have to do is we have to spread that risk. We have to do what is appropriate, and let's not just remember it's not just patients making decisions about themselves. There's dentists, there's the other people involved in any processes as well, and it's about protecting people. We do take precautions for other things. Dentists, when you walk in, for instance, to a dental surgery normally, they're not without the gloves, without visors, anything else. They do use different levels of PPE, but it's with COVID-19 and the way that people contract it, we've got to ensure that things are as clean and as safe as possible.
Okay. Another question is about key workers and so on. What exactly now, because this may have changed, when a key worker arrives in Isle of Man, do they or do they not get tested in any shape, form or fashion before they leave the airport or the seaport?
Right, so in relation to the key workers, no, because there's very strict protocols around them. So key workers still have to self-isolate. There is certain industries where we allow in key worker cases where we allow the double swab test, where they have one swab test at the start and then several days later they'll have another one, which then allows them to go back about their duties. But it is very clear with key workers that they must still self-isolate for the 14 days. But what they have to do is they go from their home to work, perform whatever limited duties they're allowed to do and are certified to do, and then travel straight from that place of work back to their home. They are not circulating, but also that one of the things I need to emphasise with key workers is what we term key workers is changed now, because that was early days when you had key workers who were coming into the island who might reside here. Most of those key workers now are back on island. The majority of key workers now are people who never actually formally set foot in the island. So you've got the boat crews, you've got aircraft crews who are coming in and then going straight back out. So it's a very different setup in terms of key workers and the majority of those key workers than it was at the start of this.
But you have got reverse key workers, ones that are working in the UK come back here to be home, and they could be here for any time. They
have to self-isolate.
Yeah, but it's no testing. I mean, maybe those people that have to wait for the once a week boat, who do get all the full testing across, it just seems like it's working on two different platforms.
Well, hang on, Paul. The testing that's done for those that wait for the boat is temperature checking. Now, we had a very long debate at the start of all this, I seem to remember, before we even did these forms of press conferences about temperature checking. All that temperature checking will identify is if someone has a fever. So the people returning aren't being swab tested, getting negative results or positive results back. It is purely a temperature check that is done at the port.
Well, Heathrow's bringing that in, aren't they? They're thinking about putting in temperature check. So it must be some merit in it. At least it picks up some cases.
Well, it will pick up anyone with a fever. That wouldn't necessarily mean they've got COVID-19. They may have a fever for a different reason. But since that's one of the common symptoms, you then wouldn't allow someone to travel if they presented with a fever, and that's what we've been operating. But it's the only form of testing really that's practical and instant testing to do at a port.
Okay, thank you.
Okay, then next up I've got Jess from Isle of Man Newspapers.
Hello, Minister Ashford. My first question is about PPE. Can you give us an update on the supply here in the island? And are you confident that with the increase of supply due to services opening, that we have got everything in place as demand grows, especially when up against global demand too?
Very good question, Jess. In terms of PPE, we are very resilient. We've been building up our supplies. We haven't been relying on the NHS supply chain. We've been going out and sourcing PPE from around the world, from as far afield as China, and bringing it into the island. We've built up a very good reserve stock for our health services. In terms of businesses returning, though, I do need to emphasise it will be for those private businesses to source their own PPE. Government will not be providing the PPE for them. But our stocks in terms of health are very resilient, and we're lucky that we are in the place we are in. We do not have shortages of PPE as some other countries have seen.
Okay, thanks. And my next question is, in terms of the services that are to open, in terms of health services, that is, what assurances can you give to those in the at-risk categories who are maybe nervous of going into these places, and what procedures are in place to better protect these people?
So people will be travelling obviously into a hospital setting for most of those services that are being turned on, or certainly a very controlled medical setting. And there is cleaning regimes in place. There is very much protocols behind every service we're turning back on. As you would expect within a medical setting, everything is risk assessed as to the risk to that person. If we had someone who is exceptionally vulnerable and we didn't feel it was right at this time for them to recommence whatever procedure or whatever they need to do, then we wouldn't make them do so. But, you know, I know it's going to be very nervous for people, and I know people are going to be exceptionally worried. It's a nervous time for a lot of people as people slowly see the changes coming through. But the one thing I would say, we take all precautions in a health setting to ensure that it is safe for people, and the risk of them contracting COVID-19 within that health setting is minimised as much as it can be. But we do recognise there is concerns, and if anyone is invited to attend for any procedure and they have any concerns, I would urge them to get in touch with the clinic or with the consultant concerned, or the consultant's office, to discuss it through and actually talk about those concerns to get some reassurance.
Would you recommend these people to maybe bring their own masks or gloves? Do you think that would help in any way? I mean, I've reported about a business supplying respirator face masks for chemotherapy patients. Does that help?
Personally, I wouldn't recommend it as such, because let's not forget, with masks and gloves, unless you apply them properly and you know how to dispose of them properly, it's actually a way of transmitting the virus if you're not doing things correctly. But what I would actually say is if people feel comfortable with that, if that's their choice and it makes them feel more comfortable about going into that setting, there's nothing to stop them doing so. It's about if that gives them comfort, but it's not going to be a recommendation.
Okay, thank you very much.
Thank you. I don't think we've got anyone from the BBC. No, we haven't. So that was the final question then for this afternoon, and it concludes today's briefing. Can I thank all our Oh, sorry, Paul is waving at me, so go on, Paul.
I don't want to take up too much time, but I went on the EasyJet site today and I could book tickets from Liverpool to the Isle of Man. Some days it was saying sold out. Now, that may be just a marketing play, but there definitely was algorithm activity, because some days the tickets were £60, some days they were £23, which shows me that people have made bookings. And there's nothing there to say that you can't fly, and this is all up in the air. You telling me there's no deal done between you and EasyJet to start flights, because why would they be putting them on sale?
Quickest answer of the day, Paul. Yes, there is no deal. There has been absolutely no deal done with EasyJet. What I would say is that people can, of course, book. Just as Logan Air, this is no different to the way Logan Air has been operating the whole way throughout the pandemic. People can book on Logan Air, but if they're not holding an exemption certificate to come into the island, they will not get through because the borders are shut.
How does that work at the airport? Does someone look at this piece of paper?
So they have to present the exemption certificate before they can board the plane.
But people from the Isle of Man still could fly out on EasyJet. There's no problem going. It's just
people can
back.
Leave the island. That has been the case since the moment the borders shut. We've never had restrictions around people leaving the island. It's people returning to the island that need to go through the appropriate process. Jess?
Thank you.
Hi. Yes, I just thought I'd ask another question in relation to those working on the COVID ward. I mean, I believe that it's got to be a very extremely stressful and tiring environment to work in, and I'm just wondering if there are any procedures in place so that staff who have been working relentlessly are able to take any time off, because I mean it would be quite an emotionally draining situation sometimes.
It most certainly is. I mean, they really are. When I talk about the front line, we literally mean they are literally on the front line. I'd like to again express my thanks to all of those that are working in those circumstances. What I would say is we try to rotate staff as much as possible. But also one of the things that's just gone out to staff through the department is because of the low level of cases, we're easing the restriction about people taking annual leave. So if people need to take annual leave or they feel exhausted, we're urging them to speak to their managers about doing so. Because there has been restrictions on annual leave prior to now, but we are relaxing those, and people do need to take a break. I think the thing we're more at danger with is we actually have a huge amount of absolutely dedicated staff who just want to keep working and keep helping and supporting the island day in, day out, and they don't want to take that break. I think that's more of a risk for us in trying to convince people that they do need time to recharge their batteries and actually think about themselves, because we have so many staff that put everyone else first, they sometimes forget about themselves.
Is there any training going on at the moment to kind of pick up when people do want to have a bit of a break, they'll be able to have people step in? What's happening there exactly? So, I mean, they'd have to probably train it, but then that's probably taking away time from the patients. What's happening?
Well, no, what we do is we obviously operate wards on a rota basis, so there are people who are already trained up in PPE. That's one of the reasons at the start of all this we had to shut off certain health services, because we were moving people around and relocating them. Demand isn't as high as it could have been, so we haven't got absolutely full brimming wards in relation to COVID, so that's allowed us more flexibility as to how we work with the staff. So there'd be certainly no need, from what I've seen in terms of staffing capacity, to have to train up anyone further than what we've already got trained up in able to try and relieve some of that pressure.
Okay, thank you very much.
And Amanda, I believe you've got another question.
Yes, thank you, Minister. Is it possible there could be a change on the 2-metre rule, as reopening businesses could struggle to break even with significantly reduced clientele due to social distancing? And will the island follow the World Health Organization's guidance to reduce the distancing to 1 metre?
Right, I need to follow up on the World Health Organization's guidance. The word for clarity, the World Health Organization's guidance isn't 1 metre. It is a minimum of 1 metre. Is the words that the at least 1 metre is the words the World Health Organization uses. We know from the scientific reports, and in fact many of them are World Health Organization reports, about the aerosol generation when someone sneezes or coughs and it travels. The 2 metre restriction we are not planning to change, and certainly aren't considering that at this time. That's far too early in the day for us to be doing that. Different countries have taken different approaches. Some, like us, have gone for the 2 metre. I think New Zealand has the 2 metre. Lots of other countries across Europe use the 2 metre. Other countries have gone for 1 metre, some for 1.5. I think it's sensible to stay with the 2 metre. To be honest, most people underestimate how far 2 metres is anyway. Or overestimated in other cases. So I think it's important we have that measure in place, and certainly I don't think there would be any benefit from going from the 2 metres to 1 metre.
Okay, thank you very much.
Okay, well, thank you very much again to our media partners for the questions today. Dr. Allinson will be here on Monday to expand on the issues around education, and I hope you all have a very pleasant weekend. Many thanks to all of you who are working in our health and care services, and for those who aren't working over the long weekend, I hope you enjoy the bank holiday on Monday. Thank you.